Awesome. Welcome everyone to our May Healthy New Moms webinar. My name is Roni and I serve as the Child and Family Program Manager at the Mental Health Association of Maryland. Our webinar series is just a avenue for us to raise awareness about maternal mental health and to provide resources and education about what moms and families are experiencing across Maryland. If you want to learn more about MHAMD, you can visit us at www.mhamd.org. So today's webinar is being recorded, and that recording will be made available after our session ends. We'll also talk about this later on, but certificates of attendance are available. And more information for that will be shared at the end. So, to kind of kick us off with our webinar today, I wanted to just share the context behind it. Latina women and mothers continue to face significant disparities in maternal health and maternal mental health outcomes. And some of the barriers that they face are systemic, linguistic, and cultural barriers to care. Today's webinar will center the experiences of Spanish-speaking communities in Maryland and explore strategies for providing culturally responsive and equitable support throughout pregnancy and the postpartum period. This session will provide a practical and culturally grounded overview of how to effectively support Latino families during pregnancy and postpartum, and we'll get to explore how culture, language, migration experiences, family dynamics, and systemic barriers shape maternal health and mental health outcomes. Through real-life examples and community-informed insights, this crash course will help providers and support persons move beyond surface-level cultural awareness and into meaningful, respectful, and effective engagement with Latino communities. So I'm so excited to announce that our speaker for today is Jocelyn Rodriguez. She is the founder and CEO of Coaching Salud Holistica, a Maryland-based organization focused on advancing health equity in Latino and immigrant communities. She is a bilingual English and Spanish health educator, community health worker, and certified childbirth educator with experience in training healthcare providers, community organizations, and public agencies. Jocelyn specializes in culturally responsive perinatal care, maternal mental health, and community-driven health education. Jocelyn, we are so excited to have you today. Thank you so much for being here, and I will pass it over to you.
Thank you so much for the opportunity to be here and share such important conversations that I feel like we don't have as often. And so I'm very excited to be representing Coaching Salud Holística, and a lot of the work that we do is really, focused on maternal health and the disparities that we're seeing in our communities. And so we're very excited to share a lot of the information that we've been able to collect thus far through the Maryland Department of Health, and as well as some tips and guidance on how you can work with different community members who fit within this category. And so, if you have at any point in time you'd like to learn more about the work that we do, or contact me for any further questions, or just using me as a soundboard, feel free to reach out to me. I will also be you can always reach out to us on Coaching Solistica, our website or our social media. We'll be able to get connected one way or another. And so it's definitely a pleasure to have all of you here connected. And the other invitation I did want to make for everybody was that we have kicked off this month, the month of May, our Maryland Latino Perinatal Health Coalition. Very excited to bring different providers and advocates and just people who are interested in Latino perinatal health to connect, to share resources, learn more about trainings, what's going on in our community, and how do we cause change. And so those meetings are every first Tuesday from 2 p.m. to 3 p.m., and those are virtual and in English. And so, again, if there's something that you are interested in, that information is also available on our website. So now jumping into what is it that we actually know. And so a lot of the information that I'm going to be sharing is a little bit from not as recent, but recent enough where it does make an impact in terms of what's going on in our community. And so if you were to guess, and reflect, if from a scale, let's say from A to F, let's say, what grade do you think Maryland would have in terms of our maternal health outcomes? And so as you reflect on that, it's unfortunate to share our report card from the March of Dimes, but our report has been that we have a D plus. That is definitely not a great grade for us, for the state of Maryland. So what we know in terms of our preterm birth rate, it's pretty high, especially when we're looking at those that are people of color, who are Medicaid recipients, and we'll actually look at that data in just a moment. But really what we're seeing here is that the preterm birth rate in Maryland was about 10.5% in 2024, which is higher than our previous year. And if we compare that to our rate as a country compared to our state, ours is higher. And so hopefully through these conversations that we're having, we're able to start to take initiative and bring more awareness to this, especially because it's something that is impacting all communities, especially those that are often underserved. And so in regards to our conversation today, I'll be focusing on our Hispanic and Latino community. And so I'll kind of be breezing through some of the data points to be able to then get to, what is it that you can actually do to serve your community. And so when we're looking here at the early prenatal care, based off of the race and ethnicity, what we're seeing is that those that are in the Hispanic and Latino community are experiencing delayed prenatal care. So, in comparison to other communities, they're the least likely to receive early prenatal care. And many times, prenatal care is true prenatal care. It happens even before pregnancy, which is reproductive health. And so many of them are not connected to a gynecologist or an OBGYN prior to that, also contributing to why there may be a delay. So this really brings awareness that we need to just reach out a little bit more to our communities so that way they're aware what are the signs of pregnancy, how do they access it, and address the other barriers that we'll also be talking about later today. When we filter out some of this information, of course, this is based off 2023, but it's not too different based off of today's data. And what we're seeing is that there's certain counties that where we're seeing the highest rates or the lowest rates that we should be most concerned about. And so a lot of the time, what we're seeing is that our communities, especially our Hispanic Latino communities, which are living in the Montgomery and Prince George's County area, Baltimore City, Baltimore County, and some in Frederick and Eastern Shore, and of course in other counties as well. We're seeing that there is a delayed access in prenatal care. And sometimes it's because there was already no existing program to support uninsured communities. And since now having the Healthy Babies Equity Act, we see that it has made an improvement to accessing prenatal care a little bit earlier for our communities that are immigrant, but it's still not enough, especially if there was no initiative prior to that in addressing those needs in that community. As we continue to filter through this information, what we're starting to see is that, as always, we have seen that our Black community is some of the most affected communities in regards to preterm birth rates, preeclampsia, and many other complications. And we're starting to see in regards to our state that, and also across the country, really, our Hispanic and Latino community is actually going up in terms of our rates. And so a lot of this has happened really because of COVID. Ever since then, it has caused a domino effect where there was a limited amount of resources available to that specific community, especially mixed status homes, and then has caused just like this ripple effect, no insurance, now having bills, let's say in collection because they weren't able to pay certain things. And so there's just so many different factors, especially with a rise in maybe systemic racism and our political climate, just making many communities feel unsafe. And so what we're seeing here is that those with the highest recorded preterm birth rate is really our Medicaid recipients. And many of the times that's because a lot of our providers are not getting compensated the same amount that private insurance is getting paid. So there's this, whether conscious or unconscious bias that is influencing the way that they're being treated and also what access to services are they receiving. So now looking at the teen birth rates. So yay, great. We're seeing a decline overall in our state of Maryland and our teen birth rates. And we're seeing that specific counties have the highest recorded, especially looking at like our Eastern Shore, our more rural areas, and also Baltimore City. Of course, we do have some concentration and some focus in our Central Maryland, but not as high compared to our rural areas. And so when we're looking at teen birth rate, While all of it has declined, when we filter that out and we're looking at our Hispanic and Latino community, we're seeing of those teens, the highest recording teen pregnancies are occurring in our Hispanic Latino community, showing the need for addressing this population. And so a lot of the times there's other programming that's being done in other areas where our Hispanic and Latino communities are not living in. And so there's this again highlights the need to be able to bring this program, create it in a way maybe that's a little bit more culturally sensitive, available maybe also in Spanish, because while we don't have the data here in regards to what does their birth look like, their personal birth look like, whether they're foreign born or US born, that does play a role. And so when we have a teen program, a teen mom program, or a teen pregnancy prevention program, and we don't have available in Spanish, reaching the communities that are growing very fast, may I say, um, we're going to continue to see this huge gap amongst all the other cultural groups in our Hispanic Latino community. And then looking at that, unfortunately, we don't have enough data what that looks like if we were to filter it in ethnicity and race across the different counties. Again, bringing attention to what's going on, why is this data not being collected, and seeing that there's high rates of Hispanic and Latino teen births, especially in our Baltimore City area, Baltimore County, and then Prince George's County. And so all to say is that what we're seeing here is that a lot of the times that those that are people of color, or especially, I haven't even begun to mention that we do have a subgroup that identifies as both Black and Hispanic and Latino, which known as our Afro-Latinos. So while our Black community and our Hispanic Latino community have significant barriers in accessing prenatal care or overall quality of care, we see that those that are identifying as Afro-Latino, which often can be from different regions in Latin America, many of the times coming from like northern Mexico, it could be from like Dominican Republic, it could be from Panama and many other countries where many individuals identify as Afro-Latino. What we're seeing is that those individuals are experiencing twice the amount of barriers compared to those who just identify as Black or just identify as Hispanic Latino. And many of the times it's because first, what we have heard from a lot of our moms is first I feel discriminated based off of how I look, my color, and then my cultural background that I don't speak English. There's this assumption that because I look a certain way, I speak English or that I have access to services. And so again, showing that there's such a need for cultural sensitivity in our programs. It's not just one big group of Latino community. There's many subgroups within each of the community, which we'll be talking about shortly that need to be need to be supported in a way that fits their subgroup. And so kind of leaning also to highlighting the unintended pregnancy a little bit again, as we mentioned, that true prenatal care begins before a pregnancy test is positive, is that there's been a rise in Hispanic and Latino individuals who have mentioned that they have an unintended pregnancy, showing the need for reproductive health education. And so we're seeing this is continuing to rise amongst all the race and ethnicity groups that we have here today. So that's a lot of data. That's the end of the data portion, but I felt it was really important just to be able to show why are we having these specific risk factors? What are we seeing in our community? So these risk factors and these barriers are contributing to a lot of those numbers. And so what we're seeing is that there's, of course, we mentioned the delayed and inadequate prenatal care, lack of health insurance, and sometimes that maybe because they're making just above the federal poverty line, they're not qualifying. Now we do have the Healthy Babies Equity Act, which is coverage for those that are undocumented or have an immigration status that typically doesn't qualify for Medicaid, but is currently pregnant. And so for those that are in need of that, they're able to apply for Medicaid during their pregnancy and 4 months postpartum. So that is a positive way forward. But of course, within there, we have different now barriers that we have to address, like insurance literacy. We're having a community who has never had insurance to having insurance and now not being able to know how do you navigate, where do I start? I got assigned a provider I didn't want. How do I fix that? Then we have immigration status and fear of deportation, or even just um, being profiled, whether it could be that they're a US born citizen and they have this fear that I'm going to be identified as somebody who is an immigrant when I was in reality born here and I'm going to be treated a certain way. But overall, what we're seeing is that those that are in our immigrant communities are afraid of the abuse, afraid of the deportation, afraid of overall the experiences that they may have in crossing and coming across, law enforcement at large. And so this could be ICE or it could be just law enforcement in general. There's such a distrust that has grown in our community, especially within this political climate that we're in, making many individuals not wanting to seek prenatal care or any type of support, whether it's diaper support, food distributions. They're not comfortable to attending those things, even though we know that there's such a high need. Food insecurity is one of the highest needs that we see across our Hispanic Latino communities. And it's very unfortunate that we see that some of these factors are also contributing to a growing gap in our insecurities for our community. We also see that language barriers, of course, Spanish and the levels of Spanish literacy, even within the community, vary. So a lot of the times material, while it could be created in Spanish, it's at a level that is not digestible for most community members, especially because of the level of education varies across individual. So sometimes just translating something in Spanish is not enough. Sometimes it's having to simplify it using more like more images to explain information as opposed to just like a handout that has a whole bunch of words. And then just acknowledging also that there may be variation in Spanish language across different communities. And so, for example, those that are coming from Spain themselves, their Spanish is completely different from Latin America just at first glance. And then within Latin America itself, Spanish varies even within region in that country. The best way I can explain it is think of it here in the US. We here in Maryland, we say soda. In the Midwest, they say pop, right? So there's different words that are used. And so sometimes there needs to be an extra step to understand who is my community? Where are they coming from? Can I get a Spanish translation of this material in a way that's more similar to the work that, sorry, the language that's being used from their region? So, for example, if I have a high density Salvadorian population, I want my Spanish material to be as close as possible to maybe a neutral or Central American Spanish, so that way they understand it. And of course, if you are somebody who's bilingual or somebody learning Spanish, or just translating material, you want to make sure that the translations is as neutral as possible because different words can mean different things, good or bad in other countries. And so we want to also avoid a misinterpretation in that. And then, of course, we have our cultural differences and lack of cultural competent care. Sometimes just because I'll take the approach of this side of just because we hire or we have somebody who is quote unquote Spanish speaking, but if they're not true representation of that community that's being served, then there's going to be a distrust still. So just putting a Spanish speaker on a team sometimes is not enough. Sometimes it's having to identify the cultural background of your community and finding somebody as close to that group. And so, for example, a lot of the times, again, I bring up our Puerto Rican community have different barriers compared to those coming from Latin America. While we all may be put under the same umbrella of Latino, we know that Puerto Ricans at the end of the day are have different access as being a citizen, right, of the US. So they have different access to resources. So maybe deportation is not something of fear. At that point, maybe it's just focused on systemic racism and profiling, as opposed to our other communities. So because of that type of insight, what we see is that communities who maybe are, again, I mentioned Central American just because I'm from Central America, so I reference it a lot. But for example, if there's a Puerto Rican therapist, for example, our community from Central America, some may feel open and trusting of that individual, but others may be like, well, you don't understand me. You don't understand what we're going through as a Central American community. And so sometimes that's an example as to what that extra step. So it's just having somebody bilingual or Spanish speaking may not always be enough. And then the other portion of that is having all of us continuing to learn, what is happening in the community, what are resources that are accessible to that community in a way that's culturally sensitive, and how can we approach them. And then we also see economic barriers and transportation challenges. Many of the times, these are communities who are living in underdeveloped communities. So, for example, there could be no sidewalks, no bus transportation. There's no transit of any kind, and making it more difficult for them to be able to access a resource, especially, for example, food distribution. If they have to go pick up a box and their only transportation is like them walking, that's the only way that they're able to get around. That's going to be extra load for them to have to carry their babies and then also a food box, making them then not want to or not be able to go get a food box. And also we see limited knowledge in healthcare system and their rights. Many of them are unaware that they can report any type of maybe malpractice or any type of complications that they have that they should be reporting. And of course, we also do see mental health stigmas across the community. The other thing I wanted to also mention is that the level of acculturation can play a significant role on how we should be servicing our communities. And so just creating, let's say, a quote unquote Latino friendly program is not enough. We have to also take into account the level of acculturation. And this is really across all immigrant communities. But essentially, what acculturation is, it's the process by which individuals or groups from one culture come into contact with another culture and undergo changes in the cultural practices, beliefs, and identity. So, this process often involves adapting to the dominant culture while retaining elements of the original culture. So, essentially, as more generations are born into the US and further away from the immigrant individuals that originally had come here, so that first generation, they lose a lot of like their culture and they become more adapting to the mainstream of the country that they're in. And sometimes that can happen as very quick from one generation to another. It can happen from the first generation themselves. They just completely just drop, on cultural background and practices. And so, but for the most part, we see that there's different levels of acculturation in groups that we can start to customize essentially our programs. And so, for example, we may have clients that speak English, but they observe La Cuarentena, which is a postpartum practice. We may have US born who are deeply Catholic, which is one of the highest recorded religions in our community. They may or you may have a client that rejects traditional practice entirely, and they don't want anything to do with that. Maybe another one who wants a epidural, but also wants a prayer ceremony. Other ones who may blend a hospital birth, but with curandera rituals, so some type of ancestral rituals that are being done. And so it's important to just avoid the assumption that, quote unquote, someone may be more Americanized and less cultural, or it may be a recent immigrant that they want traditional practices. And so again, this can vary based off person per person. And so, just kind of recapping really quickly in terms of the levels of acculturation, it's low acculturation, moderate acculturation, and high acculturation. So, low acculturation, we see those are that have the highest level of like traditional practices, like ancestral practices and beliefs that are very tied to their native cultural background. Whereas then moderate is they're bicultural. They're usually the children of immigrants. And so those are individuals who are navigating both worlds and tend to have the highest level of identity crisis, especially because they're walking within two worlds. And then with our high acculturation, we see that they primarily adopt the host cultural practices, values, and language. Now transitioning to Latin American traditions and surrounding pregnancy and childbirth. And actually before that, I wanted to pause if there was any questions or if there was any, I guess any questions or anything that I could answer. And if not, you can always pop them in the chat and we'll answer them at the end. Okay, no questions. No worries. I understand. You're absorbing all of this. And so as we're moving into this conversation about now, okay, what, Jocelyn and I learned about the why this is important and like what's going on. Let's talk about how can we actually use a lot of this information for practical skills. And so last comment I wanted to make was that there is pretty key differences within the Latino community. To kind of wrap up what we've been talking about so far, what we know is that the region of origin that the individual is from, can vary, whether that is the country they're from or the region within that country that they're from. They may have different traditional remedies, foods, and beliefs. Maybe if they identify as indigenous, or if they are tied to any indigenous practices. And then, so maybe there'll be a use of more midwives or spiritual practices. So essentially their ancestral practices, how close are they to that, if at all? And then we know that our Afro-Latino heritage, this is something that is greatly influenced by African ancestry in Latin America. And so this is something to take into consideration as well, that it may be a subgroup within another country that may have different cultural backgrounds. So just because, let's say, we have a group that's dedicated to Mexican individuals, be aware that there may be subgroups within even that group that you may start to service. And so then we also have the immigration history and also the level of trauma that comes with that, because a lot of the times we see that those that are coming to the US do experience a lot of trauma, whether it is on journey here or leaving the trauma themselves. And sometimes that can pass from generation to generation, causing a lot of like this mental health stigma, barriers, distrust. And so we also do see that newly arrived families tend to also rely more on traditional practices because that's something that they had experienced in their home country. And then we also have the difference between our US born Latino community and our immigrant community, making them very, very different in terms of what are their needs and also how to support them. In fact, something I didn't get to mention was that those that are US born Latinos or Latinas tend to report higher rates of preterm births and complications during pregnancy and postpartum compared to those that are postpartum. I think I actually may have a slide about that. Do I have a slide about that? No, I don't. But essentially, that's called the Latino paradox, where we're seeing that our immigrant communities tend to have sometimes, of course, and most likely better health outcomes when it comes to birth and postpartum compared to our US born Latinos who don't. And so now I wanted to throw, a little bit of like verbiage of like, how do we understand or how do we understand some of the cultural practices that we're seeing in our community? And so, in here, you'll see some birth worker tips. And so, however you identify, whether it's a case manager, mental health professional, essentially, would be the section for you. But I just put birth worker just to keep it as broad as possible. And so we have here familismo, and that plays a huge role in regards to decision making. And so family is going to be the heart, especially of pregnancy decisions within the Latino community, emphasizing the value of collectivism or over individualism. So this means that it's not uncommon for mothers and grandmothers to play a significant role in guiding these decisions, and their opinions are not only respected, but often crucial in the decision-making process, making it that as birth workers, for it to be essential to engage with the family dynamics respectfully and inclusively. And this starts by including family members during discussions, maybe in appointments, greeting them, engaging with them, and also being aware that, especially if there's an elder present, taking into consideration and but also not forgetting how to center our mothers. And so some of those things that you can use in regards to scripts and regarding boundaries, and because at the end of the day we want it to be a mother-centered approach. And so here it says do this, but it really is referring to birth workers. But for example, so for clients, something that we could say is for them to say to their elders or to other family members who may be overstepping, is I appreciate your advice, but I'm choosing to, or my provider recommended something different and I want to follow that, or I need some time to rest right now. And so those are scripts I like to give clients who share that, oh, but my mom said this or my grandma said this. And so just letting them know that these are some things that they can use in case, they feel the need to. And so if I were to have client with her family present, and let's say I'm kind of seeing that they're kind of like taking over the conversation and not letting her talk, or she's really not comfortable with what they're saying, or it just feels very just uncomfortable in general because the provider may be saying something versus what her family's saying. So some things I would probably say is like she's working really hard, let's give her some space. That's a really great suggestion. And she'll decide what's best for her. So I'm always redirecting the conversation back to mom. And so I use some of those scripts just in my day-to-day work just to make sure that my moms are feeling advocated in her and have the opportunity to share. And then the traditional beliefs about food. And so we know nutrition plays a huge role for mental health as well as for perinatal health. And so delving into the hot and cold theory within the community. So this concept revolves around maintaining a balance in the body, with pregnancy being considered a hot condition. As a result, certain hot foods are avoided to make sure that there's an equilibrium, that there's balance within the body, that she's not going to become overly hot. So maybe avoiding spicy food, and those type of things. And so, but in the postpartum, we have the opposite, where we see that warm foods is what is needed. And so we see that there's like soups being made, maybe types of teas, warm food, atol, which is also, something that we consume. It's like kind of like a pudding, you can say. And then, so some things that we can also do as birth workers or as advocates is really respecting and acknowledging. So always respect these food beliefs, even if they're not based on clinical evidence. Some things that I've heard is like in the postpartum is like that their family boiled beer to give them postpartum to make sure that their breast milk can go, they can have more breast milk. So those are type of conversations that I would have with her to make sure that she is practicing safe practices breastfeeding, because after consumption of alcohol, we do want her to wait some time after breastfeeding and not going straight into it. Would I disregard that completely? Depending on the relationship I have built and the rapport I have built with the individual, I would build on that. So always think of building blocks when you're educating a community. You don't want to just tell them flat out, that's incorrect, that's wrong, or something. And a lot of the times I say, like, well, what I hear is that you are having a hard time with milk supply. What we have seen through some evidence and has worked for many other moms is this, and this, right? And so a lot of the times, that's the type of approaches we do have to take is addressing our biases and our reactions, whether that's if you're somebody who does not have a poker face, that's something to work on, just being exposed to different things that maybe you are not in agreement with, or that may not align with our medical practices and guidelines. So that's something to just acknowledge, as well as learning how to integrate, their traditional food to their maybe nutrition guidelines of whatever phase that they may be in. So that way it is achievable for them. So if I give a mom, for example, food that she has never seen before, like fruits and vegetables or proteins, and she's most likely not going to want it. So she's not going to eat. And so she may choose from other food. So what I would do instead is teach her either how to make healthier versions of her food or making sure that we're advocating if we're someone who is, organizing food distributions, for example, or collecting food for her, then is food that's going to make sense for her, and teaching her and her family that there's maybe healthier options to that and alternatives. So for example, tortillas, which is a very common thing across at least Mexico and Central America, is maybe teaching them how to make spinach tortillas or turnip type of tortillas that are a little bit healthier options. And so those are just some things to take into consideration as you're having open conversations, asking questions like, are there specific foods that you would like to have after birth or during birth? Is there something that's a comfort food for you, or is there foods that you're avoiding right now? And that, if you're somebody who's working in like as a health coach or let's say a nutrition individual, that can also give you a little bit of insight. Is there something that she's missing in her diet? Is she not eating enough protein that's now causing complications? Or is she not having enough iron? Maybe that's contributing to some of her milk supply. And so it's important to remember that the goal is to respect and incorporate these cultural beliefs as seamlessly as possible. And so this approach not only honors tradition, but also enhances the trust and rapport between a caregiver and a family. And looking also at our other pregnancy practices and beliefs, and of course, this is essentially a crash course, so there's just so many to capture, but some of the things that we have seen is there's also things like susto, which is a fright that may happen to a baby. A lot of the time, it could be them reporting, let's say, that the baby's crying a lot or the baby's not sleeping, but they'll refer to it as a susto, believing that maybe that there was some type of evil presence that was essentially or evil energy sent to a baby, right? And so a lot of the times they do wear red bracelets or amulets to essentially protect the baby from that. Sometimes I'll hear like, that they'll say that they have their baby has a susto, but in reality, maybe the baby may have like issues with colics and everything. And so those are just things to kind of just like, again, be aware of like, oh, okay, I'm so glad that you did put the red bracelet or you have the amulet or that you did, this ceremony, whatever that it is that they're doing and saying like, I'm glad you did that. Can we also try this, and this? Maybe with both, your baby will feel better, right? Where we're not discrediting, we're not disregarding that. If it's no harm to anybody, then we want to, of course, promote it. And so we want to also just tie it to what may be our own practices as a birth worker or an advocate. And so similarly, we do see similar type of things reported with mental health. We see different terminology that they'll say. So literal translations could be like, for example, my soul hurts, right? Me duele me duele el alma. Those are things that they may report. And so as close as that could be for a lot of the Latino community, it may be a sign of like depression, where they just have that heaviness, essentially, is what they're describing. But the literal translation that they would explain is, my soul feels heavy. And so it's just kind of looking into, what are the conditions does your community that you're servicing typically report? Because that a lot of the times can mean life or death. So a lot of the times it could be that they're using this type of explanation, but in reality, it could be a sign of a very severe condition that they need surgery for, or they need to go to the hospital for it at that moment. So it's important to also not dismiss beliefs as myths. What we want to do is, of course, educate them and let them know like what we do have information on, and especially if it's supporting safe cultural practices and normalizing their importance, because we don't want to discredit any of that. As we just want to make sure that they are safe, though. And then with our prenatal care patterns, what we're seeing is that, again, as we mentioned, a lot of the barriers as to why they may have a delayed prenatal care. We also do see that our healthcare systems, if somebody's coming into a clinic at second trimester or third trimester seeking prenatal care, they're actually turned away. And so so they end up not having prenatal care or having to go to the emergency room. And so a lot of the times that also is contributing to the distrust and the reliance on these type of support systems. So again, it's important to help navigate systems, identify what are signs of pregnancy, if they need birth control prior to that, or if they need access to a gynecologist just on a regular basis. Those are things that we also want to educate and build that trust. And so there's just so much that we can go into, of course, regarding this topic um, and a lot of the work that we do at Coaching Solistica is that we a lot of the times are educating our partners or having opportunities for further training, more extensive training on these topics. And so if you are interested in learning about those type of trainings, we are going to be creating a self-paced module, but right now we do have some virtual sessions that we do throughout the year on Latino perinatal health and how to support them. And overall, something that you can take away from this training really is, how do you build trust as an advocate? Is, showing respect, being warm, being acknowledging that there's going to be different cultural practices amongst different members of the community, and building relationship first before education is important as well. And then some other tips I wanted to share is making sure that, of course, you're greeting family members. If you know that childcare is an issue within your community, maybe having child-friendly activities within an activity that you're aiming to do with the mom and the parents. So that way they don't feel like they're battling that. If you can provide childcare during a workshop or a visit or just any type of like activity that it can entertain children can also help feel let parents feel like they can actually stick to whether that's therapy or any other type of treatment or activity that they're doing. And so follow up consistently and just acknowledge that there may be a barrier in technology literacy as well. And so if you're able to send a text message and an email or give them a phone call, again, we're then also eliminating a lot of the issues regarding literacy, technology literacy, Spanish literacy, English literacy, all of those different things. And so one of the last things I wanted to share before opening up the floor for anybody who is interested in asking any questions is a couple resources. And so on our website, we do have under our resources tab, a tab that says resources for immigrants or immigrant communities. And so we do have resources in English and Spanish in regards to where can they get immigration support, what happens if somebody's deported, how do they find them? All of that type of information is available on our website. We also do have a resource navigation program within us here in Maryland, which is called Raiz. That's our initiative in our team. And so that is support and resources for families with babies. And so if they don't know where to start, where do I get diapers? Where do I get formula? How to get connected to WIC? Whatever it may be, our team is able to support them in English and Spanish. And you can scan the QR code, visit our website, call the phone number here on the screen or text even the word Raiz to the number here or even on WhatsApp. And so we try to make ourselves as accessible as possible or even contacting us on social media. You can always refer individuals to us or connect with us. Lastly, I also did want to share, we have created a resource guide in English and Spanish for community partners and community members to access, and again, in these two languages, on starting from the very basic, like I'm pregnant, now what, to where do I apply for insurance, to how do I get the government documents for my child? Like, how do I get a social security for my child? What happens with the birth certificate? To applying for child support and so on. And so there's so much information and resources that we have dedicated onto this guide that is available to download on our website. And then also at the end of that guide, we actually do have some educational material on the guidelines. So that's pregnancy guidelines, birth plans. There's also postpartum planning sheets there. There's how do you take care of a newborn? What do I do? What emotions am I experiencing? Resources regarding mental health and so much more. And so we have lots of information available for you all. And it's definitely been a pleasure to connect with you all. I know a lot of this information will be sent out to all of you. But if at any point in time you'd like to connect with me directly and just have these type of conversations, I would be happy to do so. My email is here on the screen, which is jocelyn@coachingsaludholistica.org. And you can visit our website to find a lot of this information as well. But I wanted to open the floor if there was any questions or or I guess anything that you'd like to share now.
Thank you so much, Jocelyn. And yes, if you all have any questions, feel free to either unmute or you can drop it in the chat and we can read that out for you. I'm not, okay, I see someone says great information, great webinar. Yes, I
Mhm.
definitely echo that. So insightful. And I
Thank,
learned so much, so much.
thank you, thank you. Definitely a pleasure to connect with everybody, and I know many of you are absorbing a lot of this information, so questions may come on after. So again, as I mentioned, feel free to reach out to me.
So yes, thank you so much, Jocelyn. We want to thank you and Coaching Salute Holistica as well for one, the amazing work that you are doing in Maryland to support, Spanish-speaking families and moms, and just for this really insightful and very important webinar topic. So thank you so much. And I want to thank everyone for joining and everyone that will watch this recording. Later on, there will be a follow-up email sent with all the information that has been shared, the slide deck, the links, and also an evaluation form, just so that we can know how to better these webinars that we're doing. It was just dropped in the chat, but we do have certificates of attendance available. They're not CEUs, but they are certificates that we give out just to, share that you attended this webinar and that you were able to be a part of the conversation today. I did want to also share a couple of events that Healthy New Moms has coming up. Next week on Wednesday, we have our Bridging Care for Moms maternal mental health training for providers. This is a free one-day event where we are welcoming professionals and providers to learn about how to better support moms and families in the community. And so if you are interested and available, you can click that link and sign up. It's going to be an amazing time. And then June 6th, if you are in the Eastern Shore, anywhere around that, environment, we are having our Fathers Matter whole family mental health training. This is where we'll go over paternal, maternal, and the whole family mental health. It's open statewide, but it will be in Denton, Maryland, and families that attend will receive a $100 stipend. And then lastly, on the 16th of next month will be our next monthly webinar, Strong Starts Infant and Early Childhood Mental Health and Supporting Families from the Beginning. And we'll explore early childhood mental health and the very important role of family members and providers in creating those safe environments for babies and young children. If you are an organization or a professional in Maryland that desires to be a webinar speaker for one of our future sessions, you can click the link in the chat and fill out that form, and someone will reach out to you. And then lastly, again, thank you everyone for attending, and we look forward to supporting moms and communities across Maryland. If you have any questions, you can email us at info.hnm@mhamd.org. Thank you all so much and have a great rest of your day. And thank you again, Jocelyn, for an amazing webinar.
Of course, thank you.